Have you ever woken up in the morning and felt a tight, stubborn ache in your lower back that seemed to come out of nowhere? Maybe you brushed it off, thinking it was just stiffness from a bad night's sleep, or simply a sign of getting older. A patient of mine once said to me, "Doctor, I thought this was just age catching up to me, but something feels different." The way she looked at me that day stayed with me because her story is one I hear far too often. I want you to imagine this. You bend down to pick up something light, or you twist just a little too quickly, and a sharp pain shoots through your back in a way it never has before. You pause, hoping it disappears in a few minutes, but instead, the discomfort lingers, or even returns the next day. These moments feel small and confusing, but they're not always as harmless as they seem. Back pain is incredibly common after 60, but what many seniors don't realize is that some types of back pain are not just aging. They're early warning signs that something deeper may be happening in the spine. So why do certain pains feel sharper or more persistent? Why do doctors urge seniors never to ignore specific symptoms? And how can you tell the difference between normal stiffness and a red flag your body is desperately trying to show you? The truth is, not all back pain is the same. Some symptoms point to nerve compression, inflammation, disc problems, or underlying conditions that can worsen if overlooked. Early recognition is one of the most powerful ways to protect your independence, your mobility, and your long-term comfort. In today's video, we're going to walk through the back pain warning signs doctors want every senior to recognize, the hidden causes behind them, and the steps you can take to protect your spine before problems grow more serious. Stay with me until the end, because understanding these signs could make all the difference in your health, your confidence, and your ability to keep doing the things you love. And if this message resonates with you, don't forget to subscribe to Senior Health Daily so we can keep learning and healing together. Why seniors misinterpret back pain. If you've ever felt a familiar ache in your back and whispered to yourself, "It's probably just age," I want you to know, you're not alone. I hear that sentence every single week in my clinic. It's one of the most common assumptions seniors make, and it breaks my heart a little each time. Not because you're wrong to wonder, but because that simple belief causes so many older adults to ignore the very signals their bodies are trying to send. The truth is, back pain is incredibly common after 60, but it isn't always caused by aging itself. Aging changes the spine, yes. The discs dry out, the joints become stiffer, the muscles lose some strength. But pain that suddenly spikes, changes in pattern, or feels different from what you've known your whole life rarely comes from age alone. It comes from something deeper, something your spine has been carrying for years, waiting for the right moment to reveal itself. I remember a gentleman in his early 70s who told me, "It hurts in the mornings, but once I move around, it's fine." I thought stiffness is just part of getting older. When I examined him, his pain pattern wasn't matching what we typically see with simple age-related stiffness. Instead, he was experiencing inflammation building up overnight, a sign that his body wasn't recovering properly. He had brushed it off for months hoping it would fade. It didn't. Instead, it grew. Many seniors ignore back pain because it comes and goes. When something disappears, the brain is quick to label it not serious. Others don't want to worry their families or feel like a burden. And sometimes, pain appears on a day when nothing unusual happened, which makes people even more likely to assume it's harmless. But not all pain behaves dramatically. Some of the most important warning signs whisper before they ever shout. As we age, our sensitivity to inflammation increases. Think of your spine like a garden that once absorbed storms with ease. Over time, the soil becomes more delicate, the roots more sensitive, the leaves quicker to react to changes in weather. The same thing happens inside your back. Old injuries that once healed well enough start resurfacing because the muscles around them have weakened. Years of posture habits suddenly begin to matter more because the body has less cushion to compensate. Even the way you sleep can affect how your spine feels the moment you wake up. Morning pain is often the first clue. During the night, your body moves less, circulation slows, and inflammation settles in the joints. When someone wakes up feeling stiff or sore most days, it's not simply age tapping them on the shoulder. It's the spine saying, "Please look closer." The reason doctors urge seniors not to ignore back pain is simple. Early signs are easier to treat than advanced problems. When you listen early, you protect your independence, your mobility, and your comfort for the years ahead. When you delay, the body has to work harder to recover. Back pain may be common, but misunderstanding it can be costly. And recognizing its early patterns may be one of the most powerful gifts you can give your future self. Warning signs. Doctors consider red flags. When we talk about back pain, most people think of soreness, stiffness, or that familiar dull ache after sitting too long. But there is another category of pain that every senior should know about, because these symptoms are not just uncomfortable. They are warning signs, the body's way of urgently waving a red flag and saying, "Pay attention, something deeper is happening here." One of the most important signs is sharp or shooting pain. It might feel like a quick bolt of electricity that catches you off guard, or a sudden stab that radiates outward. I once had a patient, a retired teacher, who told me she felt a sudden shock in her lower back whenever she bent slightly forward. She assumed it was a pulled muscle, but what she was describing was nerve compression. When a nerve becomes irritated or pinched, the pain is quicker, sharper, and more intense than normal stiffness. The body never sends that type of signal without reason. Another red flag is pain that travels down the legs. Some seniors call it a burning line. Others describe it as pins and needles shooting from the lower back into the hip or even the calf. This is often a sign that a spinal disc has shifted or thinned enough to press on the sciatic nerve. Sciatica is not something to ignore. It doesn't appear overnight for no reason. It's the result of long-term stress on the spine finally reaching a breaking point. Then there are the subtler warnings, like numbness or tingling in the legs or feet. These symptoms are especially important because they tell us the nerves are struggling. When sensation changes, the communication between the spine and the limbs becomes disrupted. I've had patients who waited months hoping the tingling would disappear. But the longer nerves remain irritated, the slower they heal. Night pain is another sign that deserves attention. When back pain wakes you from sleep or worsens when you lie down, it often means the spine is inflamed or irritated in a way that isn't related to daily activity. Pain caused by simple muscle overuse usually eases at night. Pain caused by deeper issues often intensifies. Something else I always warn my patients about is pain after a minor fall or bump. For younger people, a small fall often means nothing. But for seniors with thinning bones or early osteoporosis, even a gentle slip can cause a spinal compression fracture without dramatic symptoms. The pain might appear slowly, almost quietly, but it can grow more serious with time. And then there are the most urgent signs: sudden changes in posture, losing control of the bladder or bowels, back pain paired with fever, or unexplained weight loss. These symptoms require immediate attention. They are rare, but when they appear, they act as the body's emergency alarms. Every time I explain these red flags, I do it with the hope that more seniors will catch problems earlier and avoid long-term damage. I've met people who waited until their pain was unbearable before asking for help, and their recovery took months. I've also seen seniors who recognized symptoms early, sought guidance, and regained comfort quickly. The difference between those two paths often comes down to awareness. Your back is always speaking to you. The question is whether you recognize the language it uses when something is wrong. Listening early is one of the most powerful ways to protect your independence, mobility, and quality of life. Hidden causes of back pain seniors overlook. As we move deeper into this conversation, I want to talk about something that surprises many seniors: the hidden causes of back pain that quietly build over the years, often without any loud warning, until the body finally reaches its limit. These are the issues that hide beneath the surface, the ones that can fool even the most attentive person into believing their discomfort is just age, when in reality, something far more specific is developing. One of the most common hidden causes is old injuries that never fully healed. I've met seniors who fell off ladders in their 40s, twisted their backs gardening in their 50s, or ignored a minor car accident decades ago because the pain disappeared after a few days. But an injury doesn't always vanish completely. Sometimes it leaves behind weakened tissue, scarred joints, or small areas of instability. When you're younger, strong muscles compensate beautifully, but after 60, as muscle mass naturally decreases, that old injury can resurface, creating back pain that feels new, even though the root cause began years earlier. Another silent contributor is spinal stenosis. It sounds intimidating, but the idea is simple. Over time, as discs lose hydration and height, the space between the vertebrae becomes narrower. The spine slowly tightens around the nerves. For a long time, you might not feel anything at all. Then one day, you notice that walking too long makes your back ache, or that standing still causes a deep, tiring discomfort. It didn't start suddenly. It started quietly. Facet joint arthritis is another culprit. These tiny joints, which help your spine move smoothly, become inflamed with age, especially if alignment has been off for years. The pain they create is sharp, focused, and often confused with muscle strain. I've had patients tell me, "It hurts right here, just this one small spot." That pinpoint pain is classic facet joint irritation, and of course, degenerative disc disease often accelerates after 60. The discs between the vertebrae work like soft cushions. As they thin, the bones bear more pressure. Some people describe it as a deep ache that feels different from traditional soreness. Others say it feels like the spine is compressed, as though gravity suddenly became heavier. Osteoporosis can also play a hidden role. Not all fractures happen dramatically. Some are so small that seniors continue their days without realizing anything happened. But those tiny fractures change posture, shift weight distribution, and create chronic tension that radiates across the back. Then there are the lifestyle factors we underestimate. Poor hydration makes discs more brittle and prone to pressure. Inflammatory foods can make the tissues around the spine more reactive. Years of sitting with rounded shoulders or sleeping in an awkward position slowly reshape the spine's alignment. These things rarely cause pain all at once. They build quietly, almost politely, until one day the body can't compensate anymore. What's important to understand is that none of these causes mean your body is failing. They simply mean your spine has a long memory. It remembers every fall, every posture habit, every decade of movement or lack of movement. And when it finally speaks, it's not to punish you, but to guide you toward what needs attention. Once these hidden causes are recognized, the path to relief becomes clearer. Understanding what's happening inside your body is the first step toward helping it heal. What doctors recommend seniors do. Early, when seniors come to see me with back pain that has been lingering or changing in ways they can't quite explain, one of the first things I emphasize is how important early action truly is. Not action in the form of panic or worry, but in the form of awareness, curiosity, and gentle, informed steps that protect the spine before problems grow more difficult to manage. One of the biggest misconceptions I see is the belief that back pain should be endured until it becomes unbearable. Many older adults wait months, sometimes even years, before seeking help because the pain isn't constant or dramatic. They think, "If I can still walk, it's probably nothing serious," or "It'll go away eventually." But waiting can allow small issues to become bigger ones, especially when nerves are involved. When nerve irritation goes untreated for too long, the healing can take significantly longer. Early evaluation isn't about fear. It's about giving your body the best chance at recovery. I always encourage seniors not to label back pain as just age without understanding what's truly happening inside their spine. You deserve better than assumptions. Most people are surprised to learn that a simple examination or scan can reveal structural details that explain months of confusion and discomfort. Knowing the cause creates a sense of power and direction, and that alone brings relief. Movement is another early step that makes a world of difference. Gentle stretching, especially in the morning, helps awaken muscles that have become tight overnight. Activating the core and glute muscles gives the spine the support it needs to stay stable. You don't need intense workouts or complicated routines. What you need is consistency and movements that feel safe, controlled, and intentional. I've seen seniors dramatically improve their comfort simply by spending 5 to 10 minutes each morning helping their spine wake up. Using heat and cold correctly also matters. Warmth helps relax muscles and improve blood flow, while cold reduces inflammation and nerve irritation. When used at the right moments, these simple tools become powerful allies in easing pain naturally. Hydration is something many people overlook, but it affects the spine more than you might think. Spinal discs rely on fluid to stay cushioned and flexible. When the body is dehydrated, those discs dry out and compress more easily, increasing discomfort. Drinking water regularly throughout the day, especially in the morning, helps nourish those discs. Food is another source of both harm and healing. Some diets increase inflammation without people realizing it, while others help calm it. Identifying what aggravates your body and choosing foods that support healing can create noticeable relief. Many seniors tell me they wish they had understood the connection sooner. For those over 60, I also recommend bone density screenings. Tiny fractures can develop silently in people with osteoporosis, and catching them early prevents a cascade of additional pain and posture problems later. All these actions are not about turning your life upside down. They're about building habits that respect and support a spine that has already done so much for you. The sooner you begin, the sooner your body can respond, and the more confidence you feel returning to your daily life. Early steps create long-term strength, and that strength begins with understanding what your body is trying to tell you. Senior-friendly, at-home solutions that actually work. The more years I spend working with seniors, the clearer one truth becomes. The simplest habits, when practiced consistently, often bring the greatest relief. You don't need complicated equipment, expensive therapies, or extreme routines to improve back pain. What you need are gentle, senior-friendly habits that nourish your spine day after day, giving it room to breathe, move, and heal. One of the most powerful tools you have is a simple morning mobility routine. Many seniors tell me their worst pain happens right after waking up, when everything feels stiff and slow. That's because the spine has been in one position for hours, the discs slightly dehydrated, and the muscles cooled down. Just a few minutes of gentle movement, lifting the arms, slowly rotating the spine, tilting the pelvis, bending the knees toward the chest while still in bed, can bring warmth back to those stiff tissues. I've seen seniors go from barely standing upright in the morning to moving with comfort simply by adding 3 to 5 minutes of soft mobility before getting out of bed. Anti-inflammatory habits also play a major role. This doesn't mean you need a restrictive diet or dramatic changes. Often, small improvements create the biggest difference. Adding berries or leafy greens, choosing olive oil instead of processed oils, reducing sugary snacks, and drinking water regularly throughout the day help calm inflammation in ways you can actually feel. Many seniors don't realize how strongly their spines respond to the food they eat. Inflammation makes the nerves more reactive and the joints more sensitive. When your diet supports healing instead of aggravation, your back responds with gratitude. Strengthening is another essential piece of the puzzle, and it doesn't need to be intimidating. Simple exercises like seated leg lifts, gentle core activation, or standing hip movements help reinforce the muscles that keep your spine stable. Think of these muscles like the foundation of a house. When they're strong, everything above them feels safer. When they weaken, even little movements create strain. I always remind seniors to focus on form, breathing, and slow, steady progress rather than intensity. Posture is something many people don't realize affects every part of the spine. Years of leaning forward, slouching, or sitting in soft chairs create patterns the body begins to follow automatically. With better posture, your spine aligns naturally, reducing stress on the joints and discs. Something as simple as placing a small cushion behind the lower back, lifting the chest gently when walking, or making sure the head is balanced over the shoulders can change the way your spine feels throughout the day. Daily movement snacks are another underestimated gem. Instead of sitting for long stretches, taking 1 or 2 minutes every hour to stand up, stretch lightly, or walk a few steps helps keep the spine lubricated and the muscles awake. This simple habit prevents stiffness from building throughout the day. Footwear also matters more than most people think. Shoes with proper support keep the hips and spine aligned. Even switching from worn-out shoes to supportive ones can reduce back pain noticeably. Some seniors even benefit from cushioned insoles that relieve pressure with every step. Supplements like vitamin D, omega-3s, and magnesium can support overall bone and muscle health, but I always remind my patients that they work best when paired with movement, hydration, and posture habits. The beauty of these solutions is that they empower you. They help you realize that you don't have to live at the mercy of your back pain. You have tools within reach, gentle, simple, and effective tools that can help your spine feel lighter, stronger, and more supported every single day. As we come to the end of this conversation, I want you to take a quiet moment and let something sink in. The warning signs we've talked about today are not signs of weakness, and they are not proof that your body is giving up on you. They are signals, gentle, persistent, sometimes uncomfortable messages from a spine that has carried you through every chapter of your life. Back pain is not your enemy. It is your body reaching out and asking for support, for attention, for kindness. What amazes me, even after decades in this field, is how resilient the spine remains. I have seen people in their 60s regain strength they thought they had lost forever. I have seen 70-year-olds improve their posture, balance, and flexibility with simple habits. I have watched 80-year-olds stand taller and move more comfortably than they did years earlier. The body wants to heal. It wants to adapt. It wants to move toward comfort when we give it the chance. And this is where gratitude becomes important. Your body has shown up for you every single day, through work, stress, joy, family, loss, and change. It deserves a little patience, a little understanding, a little appreciation for everything it has carried. So as you move forward, remember the essentials. Pay attention to the red flags before they grow louder. Give your spine the habits that support and nourish it. Strengthen it gently, hydrate it daily, feed it what helps it heal, and use movement as a form of medicine rather than punishment. Small steps can create powerful changes, often faster than you expect. Most importantly, hold on to hope. Relief is possible. Improvement is possible. A healthier, more comfortable future is absolutely within reach. Stay informed. Share this video so others can protect their health too. And make sure you subscribe to Senior Health Daily, where we walk together towards strength, understanding, and lifelong well-being.